The House, both the Republican House and Senate, appreciate your time today. But we're here today to talk about the passage of the Federal Health Care Act, and H.R. 4872 is expected to pass the Senate, of course, which was using a procedural vote. And, you know, one of the things that we want to talk about today is where we believe Colorado needs to go from here, and seriously, the impact on the state of Colorado through this bill. The estimated cost is about $940 billion, probably close to $1 trillion. And most Americans are going to be required to have health insurance or pay a fine, $750 or 2% of their income. The fees for companies with less than 50 employees is going to be onerous. Who do not provide coverage is going to be $750 per worker. And the insurance subsidies for a family of 4, making up to approximately $88,000 annually, is 400% of the federal poverty level. Conversely, Medicare payroll taxes for families making more than $250 annually is going to impose a 40% tax on insurance companies that do provide so-called Cadillac plans. And it's going to cut Medicare, which I think is the most important issue, care for seniors, by $500 billion. Folks, that's going to be a lot of jobs, that's going to be a lot of stress on the Colorado economy. And both Senator Kopp and I are here today to talk about where we believe the state needs to go, what we need to do, because 60% of Americans did not want this bill passed. It was passed against their will. It was passed against the millions of phone calls that went into Congress. It was passed against people showing up to Washington, D.C. to protest this. It was passed in the face of the American public with an arrogance that I don't think we've seen in 40-plus years. And so with that, I'm going to turn this over to Senator Kopp, who's going to talk about some of the things that we can do as a state, some of the things we're going to ask for, and really call on Coloradans to continue to stand against this terrible passage of this bill. So I would like to introduce this to Senator Kopp.
Representative Stevens, thank you. Thank you, everybody, for coming here today. My name is State Senator Mike Kopp, Jefferson County. I'm the caucus chair in the Senate for the Republican Party. Representative Stevens captured it nicely. This is voter abuse. And the citizens of the state of Colorado, as well as the whole of the United States, are absolutely sick and tired of the voter abuse that is taking place out of Washington, D.C. Despite the overwhelming public opposition, Washington, D.C. Democrats steamrolled the American people and the citizens of Colorado just last night by ramming this health care bill through. And it really is baffling if you think about it. When you have 60% of the United States of America saying we do not want this bill, that Democrats from D.C. to Denver would ignore the clear, express, patently revisited sentiment of the voters of the state of Colorado. They are sick and tired of being abused by their government. And so we here in the state Senate and in the House have chosen to take a stand for the taxpayers of Colorado, since our 4 Democrat congressional members that went off to Washington, D.C. refused to do that just last night. In fact, if the 4 of them in our congressional delegation had voted against this bill, it would have died. So let me just point out a few things. We need reform that is focused on patients and their health care choices, not backroom political deals. We believe this bill will bankrupt our country, and it will degrade the quality of health care that our citizens have access to. And specifically, we believe it will cost Colorado taxpayers millions of dollars. One estimate says $100 million or up per year. I asked Governor Ritter, where do you intend to find this $100 million, Governor? Democrats, where do you intend to find an extra $100 million to pay for this mandate that was just put upon the people of Colorado? And your silence is deafening. As our state shakes off the dust of this recession over the next several years, we will only hinder economic growth and patient freedom if this bill goes into effect. Finally, as I said, we believe the bill is unconstitutional. In our letter to the Attorney General, which we have all signed, or we will sign shortly, we're asking the Attorney General to look into the issue of whether this bill is unconstitutional, as we believe it clearly is. Accordingly, the caucuses here behind you and others in our caucuses that aren't here right now have signed on to a letter to ask the Attorney General to file a lawsuit against the federal government. We want this bill stopped in its tracks. And there are others that will join these efforts as well. A couple of them are here with me today. I will introduce John Caldera from the Independence Institute in a moment. Before that, I'm going to ask State Senator Lundberg to say a brief word about the measure that is going to be moving through the legislature here in the next few weeks. Senator Lundberg.
Thank you, Senator Kopp and Representative Stevens. I appreciate your words, and you really say it quite adequately. It's not a good deal for the people of Colorado, and furthermore, it's illegal. It's unconstitutional. If you read the Constitution, Congress has enumerated powers forcing the citizens of Colorado to take their brand of medical insurance without exception is not one of them. And the 10th Amendment to the United States Constitution states very clearly that those powers not enumerated for Congress are reserved for the people and the states. And I will be preparing and introducing shortly a measure that will remind Congress of that. Honestly, it will be similar to what Representative Acree and Senator Mitchell introduced earlier this session. Unfortunately, that didn't make it past a committee in the House. I would call on the Democrat Party and members of the Senate and the House to work with us on this, because it's in the best interest of the people of Colorado to defend our constitutional rights and to stop a measure that, frankly, it's none of Congress's business. It is a matter of the state and matter of the people of Colorado, and we will be doing what we can. We hope that they'll work with us. If they don't, we'll have to move on to the next step of asserting our constitutional authority and ensuring that we don't foist this what would we call it? Albatross is one good term. There are many terms that could be called, but it's a brave new world of medical care that I'm not willing to take the people of Colorado into, and we will stand against it to the best of our ability. Thank you.